Hi, everyone. I'm Dr. Lee Rosen. I'm a minimally invasive gynecologic surgeon, and I just finished my day. We did 11 hysteroscopies, and one of the nurses who I work with, who I love so much, she suggested that I make a video to essentially help tell people what to expect after a hysteroscopy. So first of all, what is a hysteroscopy? It's a very minor procedure where a small camera is inserted into the vagina through the natural opening of the cervix into the uterus, into the cavity. So the first thing that we do is we look around and we see what the cavity of the uterus looks like. And depending upon what the issue is or why you're having the procedure, any type of abnormality can be treated. So examples include polyps, postmenopausal bleeding, fibroids, uterine septums, scar tissue, or Asherman's. These are just a couple examples. So in general, after a hysteroscopy, one can expect a couple things. You might have some abnormal bleeding, some spotting, or no spotting. You might not bleed the day of and then start bleeding afterwards. It's totally normal. You might have some cramps. Usually Advil or Tylenol is sufficient to treat the discomfort, although of course there is a range, so you'll speak with your doctor depending upon how you feel. And then one of the other things that some people experience is a little bit of sensitivity in the vaginal area, a little bit of burning. That can be from the soap that's used at the start of the procedure to help prevent infection. So if you feel that way when you get home, I suggest you take a shower and wash any of the residual soap off. Okay. You always want to double check with your provider what restrictions you have. So in my practice, patients are restricted from putting anything inside the vagina for 2 weeks. So that includes swimming, baths, sex, or use of tampons. So if you have bleeding, you have to use a pad. And then you always want to make sure that you have a scheduled follow-up with your provider to go over the procedure and go over any biopsies that were done so that you fully understand. Okay, I hope this is helpful.